Ethiopia, where the Africa Center for Disease Control and Prevention is working with the World Health Organization to coordinate an efficient and accessible COVID-19 vaccine for African countries. The two health organizations are also lobbying financial support from international financial institutions to boost their initiative in vaccine processes. The availability of a COVID-19 vaccines is widely expected to boost the African economy, which has been brought to its knees by the pandemic. Let's have more details of that in this report.
The WHO and Africa CDC agree that a swift and efficient vaccine supply is one of the top priorities for African nations. The African Union also has its own medicine agency to regulate vaccination administration.
The African Medicine Agency, it will be working very closely, of course, with WHO and other bodies to facilitate regulatory issues of any vaccines or drugs that will be available for to help control the COVID-19 pandemic. So I think it's a much needed institution.
A widely available COVID-19 vaccine will also help to open up African economies.
We can increase the surveillance in these opening processes and use the data to inform us when it's safe. And we've seen countries have had to open and close again and go and start again.
Africa needs billions of dollars for future vaccination purchase, and already the WHO and Africa CDC are mobilizing the required finances. The two health bodies also said the World Bank, the Africa Development Bank and Afro-Exim Bank are on board to support the scheme.
The board of the Afro-Exim Bank is also committing up to about $5 billion to work with the African Union Commission and Africa CDC to make sure that we procure enough vaccines for the continent. So once that arrangement is finalized and we are ready to make an announcement, it will be brought to your attention.
We've had a lot of discussion with the World Bank. They also were part of the discussions at the Gavi board meeting about financing access to the vaccine, and we will indeed be also reaching out to the African Development Bank to engage in these discussions.
Unfortunately, and despite the low number of cases and deaths so far, Africa's COVID-19 infections are increasing, and so are the fatalities. This is quite alarming, especially as health workers are falling victim of the current resurgence. Africa CDC and WHO believe the #1 task must remain to be combating the deadly virus.